your mic again.
Okay, are we working?
Yes.
Hello. Okay, good afternoon, everyone. This is July 23rd, special meeting of the Board of Supervisors. The Board of Supervisors may by motion recess into executive session to receive legal advice from the board's attorneys on any item contained within this agenda. And I'd like to ask the clerk of the board if she'd do a roll call, please.
Supervisor Angus?
Here.
Supervisor Johnson?
Present.
Supervisor Gould?
Here.
We have a quorum.
Okay, thank you very much. And Denise, before we get started, I just wanted to say that some constituents, many constituents, in fact, have expressed some confusion over the multiple sources of COVID-19 information other than coming from the Public Health Department. So I just wanted to talk about that for just a second. The Mojave County Health Department is the official designated department for the COVID-19 virus epidemic. So it's critical that the health department be the source of reports to the Board of Supervisors as a whole. And I wanted to remind our board members that changes to the manner in which the official information is dispersed does require the approval of the Board of Supervisors. So I just wanted to throw that out there and open it up to any discussion before we get started.
Madam Chair.
Supervisor Angus, you're a little weak in sound. If you could speak up a little bit.
Since you're obviously referring to me, can you hear me?
Yes, I can hear you now.
Okay. I'll take it off as speaker. Okay, so since you're referring to me, every piece of information I put out comes directly from the website. It's just in a format that's easier to read. What I said at the last meeting was that I didn't want to put any more work on our health department. People appreciate it, that they can read it easily and in one place because it's gotten very confusing with the multiple numbers and information. I've spoken to the health department. I sent it by them. So if there's anything, and I want to know where it says that anything that we put out that's not from the health department, that wasn't generated, has to go through the Board of Supervisors. Where did you get that from?
Supervisor Angus, it's the board's responsibility to make decisions as a board with the majority.
I didn't do anything. I just took information and put it out there. I didn't do anything different than what was there. So I just want to know in the future, if I do something as a supervisor, what do I have to run by the Board of Supervisors?
Supervisor Angus, I would suggest that if you want to make a motion that we change the format of our reporting procedure, that you go forward and make that motion, and certainly I think you would have support for that.
Well, so then we're going to tell the health department exactly how we wanted to do it. I think that is something the PIO should be doing, frankly, and it's not being done correctly. So if anything, I think that the PIO should be putting this information out there from the health department in a way that's easy for people to understand.
Okay, is that in the form of a motion?
I don't understand why we have to do it as a motion. Why do we have to do that? I'm just trying to understand from here on in what I have to run by the board and what I don't.
Supervisor Angus, I think as a board, we usually make decisions as a board rather than 5 independent decisions. It's less confusing for our constituents, and I think it's what boards have done throughout history is they...
Well, I'll wait, and I'll do my own research on that and see what I come up with, and if I need to do that, I will come back and do it, but I'm not prepared to do that right now.
Okay.
Madam Chairman.
Yes, go ahead.
Madam Chairman, I disagree with your statement. I don't believe that you have the right to bind my right of free speech, and that I will disseminate information to my constituents in any form that I deem necessary. I don't recall any judge putting a gag order on me or on the board, and I don't recall surrendering my rights as an individual when I ran for office. Thank you.
Okay, thank you. Anyone else?
Madam Chair.
Supervisor Johnson.
I understand what everybody's saying, but I think that as a board, we need to put out numbers that come from the health department. Doesn't mean that we can't make comments regarding those numbers that come out. I think maybe confusion might be coming from people when we put out what looks like official county numbers that might differ from what the health department's putting out. So while I understand what Supervisor Gould is saying, I don't think anybody's trying to stop him from saying his point of view or making comments on decisions that are made or what the health department puts out. It's just the official line that goes out from the county. We should all probably put that out and back up the county health department. If we have a problem with that, I have no problem changing how they do reports and that sort of thing, but at least have one official graph or something that comes out from the health department. That's all, Madam Chair.
Okay, thank you, Supervisor Johnson, and I agree with you.
Madam Chairman,
Supervisor Watson would like to...
if I could interject a thought. I think what you're discussing this morning is we're not trying to preclude anyone's ability to communicate with their constituents. I think what we're attempting to do, possibly in your statement, was that the official dissemination of the information that we have runs through the Mojave County Health Department. If a supervisor wants to embellish or somehow change some of the information on the report, that's certainly up to that district supervisor and has the ability to do that. But I think from the concern that you had was constituents being confused, I think your statement was simply that the dissemination of information from Mojave County comes from our Board of Health. And so I don't think we're trying to preclude the ability of anyone to speak to their constituents in any way, shape, or form. But for me, I recognize Denise Burley and her department as the official disseminator of that information. Thank you.
Madam Chair?
Supervisor Angus.
I'd like to ask you, where do you think I've been getting the information? And I'm a little resentful about what Supervisor Watson just said about embellishing. I have not embellished anything, not one number. The numbers, where would I get it from? I'm not making them up out of thin air. I'm getting them right from the website. In fact, we wait until it's updated. I've done it twice. You know, it's just getting information out quickly and easily to the people who are hungry for it. That's all. But I am not embellishing. I'm not making comment. I'm just putting out the numbers.
Okay. Thank you very much. Supervisor Watson.
Supervisor Angus, if you've got a recommendation to our PIO to further make it simpler for our people to understand the information, why don't you get in touch with Roger and work that out? I'm sure that's not going to be a problem.
Because I'm taking numbers from the website to give to my constituents, and I don't see the point. I will talk to him. At the last meeting, I said it. This didn't happen out of nowhere. I said I will help the county. I will do it in my office, and no one said anything at that point. So to be bombarded like this when all I wanted to do was to get information out to people is frankly a little strange. But I'm done talking about this.
So my concern here today was that there's confusion over multiple sources of COVID-19 information. And I think as a county, we've designated the Public Health Department to be the voice of
It's the same
county.
numbers.
Excuse me. I didn't hear you, Supervisor Angus, and let me finish speaking. So we have designated the health department to be the lead agency to disseminate this information out to the public. And I'm simply saying that many constituents have contacted my office saying, whose numbers do we believe? Do we believe the Arizona Department of Public Health or the Mojave County Public Department of Health, or do we believe what we're reading on Facebook? Our constituents are confused, and I'm not necessarily pointing fingers at you, Supervisor Angus. I'm saying that there's multiple sources of information, and people that I'm talking to are confused because these numbers are not all the same. I'm just saying that Mojave County needs to be consistent in their reporting to the public and only have one source of that information. And if we want that source of information changed, or we want it to look differently, then we simply need to make a motion, take it to the vote of the supervisors, and go with the majority wishes for the good of the people. Any other discussion?
Supervisor Bishop, may I speak?
You may if you turn on your microphone.
It's on?
Okay.
But it's green, at least.
Okay, Denise Burley, I will turn the floor over to you now.
Thank you. Supervisor Angus, I was filled in on where you're going, and yes, we've had discussions, and if it would be of assistance to you and to the public, I think that we can provide that data to you, and we will make that happen for you so that you can reach out, and we'll make it just an official thing coming from our office. And that way you can share that without any concern that it's coming from any direction. And it sounds like that may be where the concern is. I don't want to fill in gaps there, but I do want to offer that to you. And I appreciate your willingness and desire to keep extra work off our department. I really do. But in this case, I really want to make that offer to you, because I understand your concerns, I understand your desire to have more data out there, and we want to fulfill that and fill that space for you when we can.
Madam Chair.
Supervisor Johnson, go ahead.
Thank you, Madam Chair, and I appreciate what the director's saying, but I have a lot of things that I'd like to see on the website also, and I've backed off because I know you people are busy, and some of it can't be done, at least in a timely or a costly manner, without going back to day one to try to put all this together. I think if you're going to do something for one supervisor, then it should be done for all, and I think that's probably what the chairman was bringing up, that if we do it as a board, then everybody has the same information. So if somebody contacts myself or another supervisor and says, how come Supervisor Gould has these numbers and you don't, it just stays confusion.
Thank you, Supervisor Johnson. I appreciate that comment.
Any other comments? Okay, Ms. Burley, I'll turn the floor over to you for your report on the County Public Health Director's recent issues, actions, events, and county responses regarding the COVID-19 updates, and we'll be taking any necessary actions based upon these updates. Thank you.
Thank you, Madam Chair, members of the board. I'll review the numbers to start. We've had a total of 2,500 cases in the county to date. 648 recovered, 121 deaths total. We continue to see a growth in cases, although, as you've noticed the last few days, we have seen a slight drop, but we are not in a position really to say that that will be an ongoing trend, and we will continue to monitor those case counts and provide that information back to you in terms of looking at that trends over time. But a few days does not make a trend yet, and so we have more work to be done. I think we'll move on to hospital capacity and looking at the report. It doesn't look like we have any major issues at this point. I know that Havasu Regional Medical Center is reaching out for staffing assistance, and in large part, this is not uncommon in hospitals that you will see that between staff becoming sick and seeing an increase in patients, and trying to give your nurses and staff a break throughout this so they can operate at their highest level. You kind of reach those points where you need to ask for some assistance, and that is where they are at. So I know they're doing everything possible to ensure the safety of their patients and their staff, and will continue to operate in that mode. In terms of ventilator use, I think we're seeing sort of an increase or somewhat of an increase in those numbers, but again, that fluctuates on a daily basis, and those are not always COVID-related cases. So there's a combination of those that are having surgeries and injuries, accidents, et cetera, that they're responding to that is in conjunction with COVID cases. So, any questions about hospital capacity?
Madam Chair?
Go ahead.
Director Burley, looking at the reports, I'm seeing that we're not keeping up to date from Lake Havasu. Is there any reason for that? Are they going to catch up?
They will need to catch up. It's a required reporting process for them to ADHS, so I'll follow up with that. Thank you.
Thank you.
Okay. An update on testing. I know we have been meeting with, by phone with local leaders and some of the hospital and clinic personnel in the county to discuss how to increase our testing options throughout the county. North Country Healthcare is stepping into this with a testing event in Bullhead City, both, so one tomorrow and one on Saturday. Both are from 8 o'clock to 11 o'clock. The participants needed to pre-register for these spaces to participate, so those are all full. They'll be doing 100 people per day, and those are symptomatic and asymptomatic. So you don't need a doctor's order, and you don't need to have symptoms to show up for the testing. But you do need to have that appointment, basically. So if you haven't pre-registered, just know that we are looking forward. And they're doing this as a trial event, and then afterwards, after the assessment, they'll look at how or if they can expand beyond that. But they're also working in communication with leadership in Lake Havasu City and Kingman to look at how they can expand their services both at their physical location in each of those sites, those communities, but also through events or drive-through. So that'll be an ongoing conversation, and we'll continue to work with each of those communities to expand that out. Any questions on testing?
And Denise, I have a question from a constituent. This constituent, and I know you've answered this before, but she's listening. This constituent wants to know that when you do contact tracing and you tell those that have been exposed to a positive COVID-19 patient to quarantine, monitor for symptoms, why is it that we're not telling them to go get tested?
Well, I think that's a great question. Primarily because the incubation period for the virus is 2 to 14 days. So on one day you could be negative and then 2 days later positive. Hence the reason we ask you to stay in quarantine, so you're staying away from other people and social distancing, wearing masks. In addition, you are, so you're keeping yourself safe, you're keeping those in your family and friends safe. And then monitoring for symptoms allows you to ensure that as you start, if you have any change in your health, then that would be a time that you might consider going to get tested. But at least then there's a measure there where it's not just about being around somebody, but it's about actually having symptoms. And in those cases, that's when you would actually catch the virus if it exists in your body.
Okay, and at that point, you probably asked them if they've attended any large gatherings, and if the answer to that is yes, where do you go from there?
Well, we do try to find out who they've been around, so we do ask for specific information. It's available. Depending upon the circumstance, we may try to contact the event organizer to get more information, but, you know, it's hard for people to remember who they've been around and whether or not that's really been close contact. So taking into consideration 10 to 15 minutes within 6 feet, no masks or any other protection. And so we do the best that we can in trying to make sure that those individuals can try to recognize that social distancing piece and when they weren't, and then identify those individuals that they had been talking to. But it would be, it might concern people if we just, went to the event organizer and said, we had one person who was positive within your event, and you need to notify everybody. That creates quite a bit of panic when that person may have had minimal exposure to the larger group and more so to a smaller group.
Okay, and how are we doing with availability of tests for those people that just want to go in and have a test? How's that going in our county?
I think there are very few providers in our county that are offering testing to asymptomatic individuals or those that are not exhibiting any symptoms. And in large part, you can relate that to the number of testing sites that are available in the community and then the need to kind of focus your energy and your time on those that are having symptoms and exhibiting symptoms. Secondly, I think you can relate that to testing supplies and ensuring that there are adequate testing supplies in the community, which testing supplies can be very different. So you have a rapid test kit, for example, which we've brought up here in meetings, and there's several out there now, and hospitals have their version of that. Provider offices may have their version of that. And those rapid test kits require a very specific test kit that you get directly from that manufacturer. So it's not the generic kit, for example, that we may get from the state health department. Those cannot be used in those rapid testing kits. So, again, with the increase in cases throughout the country, we're again seeing sort of a limited supply of test kits available out there, and that supply chain kind of shrunk a little bit again. And then on the flip side of that, of course, is the lab capacity to actually run those tests.
Right, that brings up another question. What is the possibility of bringing a new lab to Mojave County, or could the county take some of our funding and develop a county lab temporarily while this pandemic is going forward?
Well, I think it would depend on whether or not so I don't know that we would have the ability really to get through state licensure, lab licensure, within a reasonable time frame to actually open up, quote unquote, a lab. What we would look at potentially is one of these rapid testing machines and using those resources in that form. The challenge for us as public health is that, I'll use the Cadell as an example, that model. What they require is, in order to give you a machine, and they'll actually give you a machine if you commit to running 250 flu tests during the flu season coming up. Well, public health doesn't run flu tests here, so we don't have a need for that machine, and we've already asked, trade out COVID tests for flu tests. So we would have 250 flu tests to figure out what to do with. And then we would need to purchase all of the test kits from Cadell also. So I also believe they may be, as of a couple of weeks ago, they were about 5 weeks out in terms of their ability to deliver. There is and I was going to bring this up a little bit later on in the meeting if it's okay to bring it up now. There is a physician's office in Lake Havasu City that actually agreed to receive 2 of those Cadell test kits. And unfortunately what happened is they agreed to accept 2 machines, testing machines, and what they received were the test kits, but somehow the testing machines were lost in transit, or something happened. I don't know exactly what. But we were asked to, and I believe the board is being asked to provide a letter of support to Cadell to ask them to move this particular primary practice office a little higher in the priority list, since these machines have been lost in transit somewhere, to make sure that they get like the next 2 machines instead of being put back on a list, a waiting list. So I wanted to present that to the board as a possibility and see if there was interest there in providing a letter of support for that effort. And if so, then I can let those individuals know.
Okay, is there any discussion on whether or not the board would like to sign a letter of support?
Madam Chair?
Madam Chair? Oh, sorry.
Supervisor Johnson?
I would make a motion. I believe it's Lake Havasu Primary Care that we submit a letter from the board in support of them receiving the machines.
I'll second the motion.
Okay, we have a motion and a second. Supervisor Angus, did you have a comment?
I just have a question, a clarification. So these two test machines, is this clinic or whatever it is, are they paying for them, or are they just getting them because they're promising to do?
Sure.
I lost that somehow.
No. I totally understand, Supervisor Angus. The way it's structured, the way this company operates, is that they will provide the machines for free if you commit to running 250 flu tests using these machines during the flu season. And so you can purchase the additional COVID tests, but you have to commit to those 250 flu tests no matter what to get the machine.
Has this been offered to all the cities? Do they know about it? I don't know about the offer. Well, only one's kind of taken the initiative, but do the other cities know about it?
Well, yes, I believe they know about the Cadell machine, and I mean, we have shared that information out with the group. So how they've chosen to pursue that, I'm not familiar with that information.
Okay. All right.
Okay, we have a motion on the floor and a second. There's no further discussion. All those in favor say aye.
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 Any opposed? Okay, motion passes.
Madam Chair, I have some questions on the testing.
Yes, Supervisor Johnson.
Thank you. Sonora Quest has a backlog of something like 61,000 tests, and the average wait time of 13 days for results. We've had at least 3 days this past week where PCR tests at the state level has been below the 10,000. I understand there is a testing capacity issue that is being worked on, but our average daily test has actually gone down by nearly half. Do you have any idea what the issue is?
Not that I'm aware of. You know, we've been providing test kits out in the community as we've received them from ADHS and distributing those out. So to the best of our ability, we're making sure that those are not staying in our office and those are provided. You know, beyond that, and we try to fulfill every request that we get, and we may not fulfill it completely. If someone were to ask for 1,000 test kits, we might, depending upon how many we have on hand, we might be able to provide 500 or, you know, something along those lines. But I'm not aware of any shortage of those test kits in the community, which would be the major limiting factor there. But I can also do a little bit of research and see if there's any other issues going on.
I guess what's concerning to me is this backlog and the time delay. Is this going to force us to make a decision that we probably don't want to make? If it's taken 13 days to get the lab results back, basically their quarantine is probably over. And then with our backlog, trying to catch up with the tracing, should we have like a cutoff date and say we're going to follow up with the people from a month ago as best we can and start working on the ones that we can maybe help out with we could still have, some kind of contact with the county, so if people have it, they can call and we can answer any questions that they might have and try to help them with whatever their needs are. But in order for us to maybe slow down this pandemic, would that be something we might want to look at?
Yes, Supervisor Johnson, very good point. So yes, we are looking at strategically placing our investigators in positions where we are dealing, of course, with the most recent cases moving forward, because that's an obvious choice. That's where we can actually impact future numbers, is where we look for. And then where possible, we'll go back and try to catch up with those that are no more than about a month out, because, we might be able to catch some that through contact tracing and some other, and they may be still exhibiting symptoms, answer questions, things of that nature, but that's about as far back probably as we'd like to go in order to be effective.
Okay. It seems like recently we've been having a higher positivity rate. Do you know what the positivity rate is now?
So, you know what? I'm sorry, I just looked at that yesterday, and I was looking, so when we look at positivity rate, just to be clear, and we use positivity rate, we can calculate it based on our numbers because those are confirmed cases only, right? Because if we go to ADHS's website and look at their confirmed cases, they have like a 9.3% number for PCR testing, which is the diagnostic testing. And, but they include probables and confirmed cases. So it sort of muddies the waters a bit. So we can, and that's something that I would like to add to our webpage, if you would agree to that, and look at how we might update that maybe on a weekly basis. I know we use Mondays as sort of our guide to update the webpage on some of those other issues that don't change dramatically over time, is to offer that as something that we can provide on that webpage.
Okay. Also, it seems like lately we've been having an awful lot of deaths. What is our death rate now? Do you know?
I do not actually have a death rate available for you, but I can provide that for you right after the meeting.
And thank you. If you need it, I would make a motion to place the positivity rate on our webpage.
Okay, Supervisor Johnson's made a motion. Supervisor Watson, was that a second?
Yes, I second the motion, but
Okay, we have a motion and a second. Any further discussion? All those in favor say aye.
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 Any opposed? Okay, thank you. Motion passes.
We'll make that happen then.
Madam Chair, I'd like to answer Buster Johnson's question about the death rate.
Supervisor
There's been
Angus,
100,
go ahead.
as of yesterday, there was 100. Can you hear me?
Yes, I'm trying to acknowledge you, Supervisor Angus. Go ahead.
Oh, I thought you did. Okay. Total deaths are 115. The death rate is 0.05%. That's of the percentage of population, not of the positives. So I don't know if that's exactly what you were asking, but that's the number.
Madam Chair, Supervisor Angus, I appreciate that, but wouldn't we do it by the positive cases and the death rate instead of doing it by everybody?
I think both are interesting, but I understand your point.
So Denise, are you clear on how the board wants that reported to you now?
I believe so. And what I'll do is I'll put it into an email and make sure that you're comfortable with what we're planning to move forward with. And I can send that to county manager and make sure that that's what you wish. We'll make sure we get that done. And we'll also put down how we plan to calculate that number so you can see what it looks like and where our sources are. Absolutely.
Okay, that'll help with some of the confusion. Thank you. Supervisor Watson.
Thank you, Chairman Bishop. I have a couple questions, not concerning the testing or the mortality rate, but a concern I have for the Wallapai Nation. Over the last 3 weeks, I've lost several good friends in that area. Does the Wallapai Nation report their cases to Mojave County?
So we actually, at their discretion, if you will, they provide us with those numbers through their electronic, I'm not sure if it comes through the electronic medical record, lab system, or if they provide them directly to us, but those are cases that they investigate, so it's a courtesy that they provide that information to us.
Okay, so we're just dependent upon their ability to send it as they do. And my concern up there is, and my question is this, is there a higher mortality rate for that particular population than we have in other populations throughout Mojave County? Do you know?
I don't know the answer to that right off the cuff, so I'll look into that for you.
I'd appreciate that. That kind of leads into my second question.
I got an answer already.
Okay, great.
So both.
Okay.
Yes. So you pointed out two things. Can you remind me what those are? Because I glanced down and looked at my phone. So underlying health conditions, and the mortality rate is higher? Oh, okay. Sorry. It's helpful and not so helpful, right? It's very helpful. So Peach Springs reports to us. So that's how we get those numbers. And then you were asking about the mortality rate for them, and you pointed out two things. Do you remember what those two things were just now?
Well, yes. My question is the percentage of fatalities due to the virus of those that have contacted
Yes.
the virus. Is it higher than the 0.005 that we have for
Yes,
the rest of the population?
it is.
And what would that number be?
I would need to look that up for you. I just
Okay.
know that it is.
But my
That's an
concern is that
anecdotal-
we're experiencing a higher mortality rate on the Wallapai Nation that we may be experiencing in other segments of the population. And that leads into another question that I have, if you don't mind. Have we recognized any particular reasons for higher percentages in different regions of Mojave County that can be readily identifiable?
Well, I think remoteness, access to health care, culture, the resources, I think, are oftentimes sort of factors that play into sort of an increased virus rate, rate of infection in certain areas. So if they have running water or if they don't, if they have access to health care, if they, how far do they have to travel to that? I think there's a lot of different factors that play into why there might be differences, but I don't know that I could specify a certain area at this point in time to be accurate. So I could.
And we're attempting to look for those constantly, correct?
Correct.
Okay. And the reason I bring this up is because, the numbers should track our populations, and for some reason or other, we're a little bit skewed on a couple of our segments of Mojave County that are higher than others. And
True.
Would just be my assumption that the numbers should follow the populations a little closer. But thank you for indulging me on those
Sure.
questions and receiving those answers. I'll put my muzzle back on.
No, not at all. And we'll look for
Madam Chair.
some responses for you.
Yes, go ahead.
Thank you, Madam Chair. Kind of a follow-up to Supervisor Watson's. Regarding clusters, Bullhead City had a couple of days where they had quite a few people, and so did Lake Havasu that tested positive. Are we seeing an event in any of these areas that led to that, or are we still blaming it on family and so-called friends.
Well, I think I haven't heard from staff that there's been any particular events per se that are causing, the transmission of the virus and getting people together. But we continue to see gatherings, of family and friends. And in many of those cases, we're seeing the spread go around in those particular groups. So those can be both large and small. If you look at parties and things of that nature, those can easily expose, a large number of people.
I guess the follow-up to that would be, I don't know if it would be worthwhile, but if we have 5 people that come down with it after having a barbecue or something, if that isn't in fact true, I don't know that we shouldn't be putting that out to kind of warn people that, hey, even though they are family and friends, it is being passed around.
Yeah, I think that could be addressed through either a press release or something to try to emphasize the importance of the social distancing and mask use even when you are with family and friends, because that is, I think you become comfortable in those settings, in a normal setting that would be fine, but not in today's day and age. So would
Thank
that
you,
be an
Madam Chair.
acceptable approach to you?
I believe so, because I think, maybe especially in the Lake Havasu area, if we are saying that, where we're saying, hey, you people are getting together for whatever kind of family events or something, and we're seeing, as an example, 5 people got it from a gathering the other day. We don't have to say who it was or where it was, but just to reinforce the fact that it's not all that safe just because you're with family and friends.
Good point. Thank you. Okay. All right. Okay. Staffing update. Just wanted you to be aware of where we're at with the positions that you have generously funded the health department to fill. We have 3 data entry positions that have been filled. Those have been filled for some time, so those individuals are fully operational. We have 6 community health education specialists which will operate as investigators. Those individuals started Monday. They were trained yesterday, and they have started accepting cases. We have 2 additional health educators starting on Monday, and those individuals should be trained up by Wednesday again. And so that will bring us to 8. We have human resources helping with the interview process for the 2 office specialist positions. Those interviews, as I understand it, are occurring this week, and hopefully we'll have a decision either late this week or early next week. And we anticipate having all of the positions filled, with the exception of the 4 nursing positions, because those have been our challenge. But the other positions we expect to have filled by I'd say the end of this month to the first week in August. So we'll be fully staffed at that point.
So Denise, you have 4 nursing positions that you still have not filled?
Correct.
Okay.
Correct.
Are there any particular requirements for the level of nursing experience that's?
I believe we are asking for an RN.
Okay, thank you.
And that way they can operate independently if an LPN requires that they work under a nurse's license, so.
Okay.
And finally, I just wanted to make sure that you were aware that there's a governor's press conference today at 3 o'clock. And I'm not certain what the content will be, but I'm sure we'll learn at that point.
Okay, well, hopefully the governor will have some news on whether or not we'll be reopening the schools. But we'll see. 3 o'clock today, thank you. Do you have anything else?
I do not have anything else.
Do the board
Madam
members
Chair?
have any further questions? Supervisor Angus?
Yeah, I have a couple, and I just want to go back a little to the lab testing. And as everyone can figure out, the more tests they are, and they are backed up, we went through that. But there's another unintended consequences. People who have, I've been hearing people who have labs for other ailments besides COVID are not getting their results in time. And so that is the argument against blitz testing. You know, it's by the time you get them back, they are usually not good. It's taking a long time. And then the other thing that people aren't talking about that I think needs to be talked about is the reliability of these tests. We're hearing all across the country that the tests aren't as reliable as we were being told. And so, you know, we can talk about numbers and tests, but, you know, when you hear that we had this big number of positives out of the blue, you know, you have to ask yourself, is it even... You know, there's no quality control on it because the government approved these things so quickly that none of them are basically FDA approved. Somebody gave me an analogy. It's like everyone's got a what do they call the driving license that you get before you get your license. So I just want everyone to understand that the testing isn't the end all. And I am not for blitz testing. I think what we did in the beginning, telling people to act like you have it, is much better than having people wait, you know, and being very nervous. I mean, that's all we're doing is we're going home and people are biting their nails about whether they have it or not. And then 2 weeks later, they're complaining to one of us that they haven't gotten their test back. And it's creating more problems. So, you know, I would really like to see everyone stick to testing people who are symptomatic. Because really it's just a snapshot in time. And so, Denise, what do you think about that? I mean, as we do more and more testing, and we're letting people who are stressed, if people have anxiety about maybe getting it, I think we're not getting information out. And is there any way we can get? Maybe our PIO can get the facts out. I mean, I don't know about the rest of the board, but I'm still hearing people think that if they get this, they are going to die. They think it's the plague, and that's what's fueling this anxiety, and that's just not true. So I think the newspapers have done a bad job. I do. I think that just more information needs to get out about your health and how you can help avoid getting it, and I just don't see us doing it. Do you see this as something that public health can have a role in, Denise?
I do. Thank you, Supervisor Angus. I really do. And I think prevention is, of course, our main mantra in any case of disease prevention. So I do think messaging that out would be very helpful. I think we can, to your point, provide more data and put that either on our website or at the very least make it available to all of you to share in your various sites. I do want to add one point of clarification, Supervisor Angus, on the testing. What we see is when the rapid testing machines those machines were approved under an emergency approval, and in those cases, the FDA did not have the opportunity to fully vet them as they would other lab equipment because they were trying to roll them out quickly. So the standard for those, as you know, with our Abbott machine is a really great example. In learning, they rolled out the Abbott under this emergency order, and then come to find out and learn through, in a short period of time, that we have a 40% false negative rate. And hence the reason we send those tests out to the state lab for confirmation, or anybody else using one of these kits would need to do the same thing. The Cadell machine has a much higher sensitivity rate, which is what a higher sensitivity rate gives you a lower false negative rate. So in that case, it's better, but still we need to be mindful of the fact that some of these rapid test kits are not as accurate as these diagnostic PCR tests, which is the nasal pharyngeal swabs and the kind of the tickle your brain approach to collecting a specimen.
Right, and those are the ones that are taking up to 2 weeks to get
That's
back.
correct. Correct.
Okay, that's all I have.
Okay. Does anyone else have any comments or questions?
Madam Chairman.
Supervisor Gold.
Denise, what is the false negative rate on the Cadell machine?
I believe the sensitivity rate was 83 or 87% on that machine, so a false negative would be 13%.
Thank you.
Okay. County Manager, do you have anything to add?
Madam Chair, I do not have anything to add.
Okay. Mr. Esplin?
Denise answered all the questions.
No, thank you.
All right. This meeting is adjourned.